Good morning, and today we are going to make a short video on chronic wound on the right leg, on the medial part of the right leg, below the medial malleolus, which has been there for several months and not healing with all the conventional methods of treatment. And the patient has come to us now for the treatment of this, and we have initiated our regenerative wound care protocols on this patient without any debridement. In fact, the first dressing has already taken place a couple of days ago with some very visible changes today with the development of granulation tissue, and now we are going to demonstrate to you the wound and how it is going to progress sequentially. We are going to update you with the new videos. Now if you look at this wound very carefully, this is a wound on the medial side, most probably of ischemic origin. Could also be a possibility of diabetes leading to this necrosis of this soft tissue. Now if you look at where my figure is showing, you see a small island of granulation tissue which was not there initially when she came. Now this is the development after one dressing, and there was a large area which was covered with slough in this part of the wound, which has substantially decreased in size now, and you are also beginning to see the one bluish layer all around the tissue, which is still very faint and not very clearly visible, but in the coming videos probably it will be very marked. And what we are witnessing is this is a old wound, approximately I think more than a month, but it had been under the treatment of some other specialists. They reached us just last week, and we have done the necessary kind of regenerative, and we have just cleaned it with saline without the use of any antiseptics, harsh antiseptics like betadine and hydrogen peroxide. And now what you are seeing is the application of growth factors. It is remarkably the complexion has changed within one dressing, that is 2 days, gap of 48 hours. Now we are going to continue this protocol, and probably are going to get the next edition of this video in the next week or so, wherein you will see considerable improvement leading towards the eventual closure of this wound. Thank you very much.